our vision is that we're already starting this with the Assura model, and we'll talk about that today. But we visualize that the financial relationships between PBMs and payers will become more of a joint P&L than a transactional arrangement like it is today, right? Where there's discounts and rebates, right? Like, we PBMs have to be incentivized on the same incentives that the health plans have. And, sure, everybody has costs, and boy, are they going up now. Anybody has seen their costs going up, operating costs going up with inflation? No, just us. So look, it costs money to have good people and to have fancy events. But truthfully, there should be some sort of basic administrative fees to cover the cost of doing business. But the real upside and downside, the profits or the loss based on performance, has to be driven by aligned financial outcomes adjusted for two things: healthcare outcomes and consumer experience, right? User experience, whether it's consumer, provider, or payer. This is not impossible. This exists in other places. I hate to say it, but the federal government, Medicare Advantage, is probably the most sophisticated around this. Can you believe that? Right? Imagine if the private sector, if PBMs took the mantle here in partnership with payers and just changed the whole model. No more nonsense about discounts and AWPs and rebate guarantees. I mean, can you imagine if we just had the same incentives and we adjusted them for outcomes? I mean, we would really be aligned. And you would be forced not to be interested in all of the volume in the market as a PBM. You would be choosing the payers, because if you're partnering with payers that aren't good at what they do, you're going to lose money. Right? So it's not about having as much scale, as much volume. It's about having those payers that deliver financial value, health outcomes, and the consumer experience.